Dear friends, we are all here for a very solemn event, the 5th J.K. Trivedi Memorial Lecture to be delivered by Prof Mohan Isaac. My job is to welcome all of you to this event. As we all know, late Professor J.K. Trivedi was the president of the Indian Psychiatric Society. He was the editor of the Indian Journal of Psychiatry, and he was also the member of the World Psychiatric Association Board. And it was in 2009, some of us met together and formed the National Alliance for Mental Health, which is a public charitable trust for the advancement of mental health. Professor J.K. Trivedi was the founder, vice president of this National Alliance for Mental Health, and we have been holding this annual lecture in his memory. This time, the 5th lecture is being organized by the Department of Psychiatry at the Pushpagiri Institute of Medical Sciences, Tiruvalla, Kerala. And I am very happy to welcome all of you to this event. The lecture is going to be delivered by Professor Mohan Isaac, who needs no introduction. He has been a professor of psychiatry at the National Institute of Mental Health and Neurosciences in Bangalore. Currently, professor of psychiatry at the University of Western Australia in Perth. He has been also president of the Indian Psychiatric Society South Zone. He'll be talking to us on practicing psychiatry in the post-COVID world. And I have great happiness to welcome him. Today, we also have an eminent guest, the president of the World Psychiatric Association, Dr. Afzal Javed, who will be the chief guest and who has agreed to inaugurate this meeting. Hearty welcome to you, Dr. Afzal Javed, who has been a great friend of the J.K. Trivedi, Indian psychiatry, as well as one of the major, the president of the parent organization, World Psychiatric Organization. He has joined us at it's very early morning time in London at 4:30 a.m. and still he has agreed to join us. And we also have Professor Dr. U.C. Garg, who is the Vice President of the National Alliance for Mental Health. He will be giving a tribute to J.K. Trivedi. And also Dr. Rakesh Chadda, who is the Professor and Head of the Department of Psychiatry at All India Institute of Medical Sciences in New Delhi, and also the Secretary General of the World Association for Mental Health. He will be World Association for Social Psychiatry. He will be speaking a few words, introducing the speaker. I also have a lot of eminent guests, Professor R.S. Murthy, Bangalore, Dr. K.S. Gind from Canada, and many others. We have great pleasure to welcome all of you to this meeting, and I am sure the deliberations will be a big success. I also want to thank the Board of Trustees of the National Alliance for Mental Health for allowing us to hold this meeting on this occasion. Welcoming you all once again. Thank you.
Professor J.K. Trivedi was one of the most eminent psychiatrists India has produced. He was an academician, researcher, teacher, and leader of rare abilities and wisdom. He was an excellent psychiatrist who was very well known internationally. He was a regular delegate of almost all the national and zonal conferences of Indian Psychiatric Society.
It is indeed a proud privilege for me, not only as a personal friend of JKT, but also as the president of WPA to attend this lecture in the memory of JKT, who was a zonal representative and president of a member society during his time.
People are there now.
He has been very instrumental in bringing Indian psychiatry to the international scene. And I have personally seen him with his dedicated work. I congratulate the National Alliance, and especially inviting such an important keynote speaker, Professor Mohan Isaac. I think this is probably one of the best tributes that you can give him by inviting Professor Mohan Isaac to deliver a lecture in memory of a great academician, clinician, and a friend of international psychiatry.
Dr. Mohan Isaac is, I think, one of the most renowned psychiatrists India has produced. He served the National Institute of Mental Health and Neurosciences for a long period, starting from early 70s to 2005. And he was a professor and head Department of Psychiatry at NAMH. He has been a pioneer in community psychiatry movement in India. Currently, Dr. Mohan Isaac is serving as Professor of Psychiatry in University of West Australia at Perth. He has also been President of Indian Psychiatric Society South Zone.
Thank you very much, Professor Rakesh Chadda, for your very kind words. I must begin by saying how grateful I am to the National Alliance for Mental Health India and all its office bearers, Dr. Professor Roy Abraham, Dr. Garg, Dr. Varghese Punnoose, for kindly inviting me to deliver this fifth J.K. Trivedi lecture. It would be good if all people could mute so that there will not be any disturbance. May I request everybody to mute their audio so that there are no disturbances. I want to also reassure Dr. Roy and Dr. Rakesh that you don't have to feel very apologetic about waking up Dr. Afzal Javed at 4:30, because as far as I know, he sleeps very little. Now, how do I know this sitting in India now? Any time of the day or night, you send him a mail. Within 5 minutes, you get a reply. Then I sometimes wonder, oh, this must be 12 o'clock or 1 o'clock in his place, because, you know, there is 3 or 4 hours difference. I would have sent the mail at about 5:30 a.m. or 6 a.m. And within 5 minutes, the reply comes. So Roy and Rakesh, I want to assure you, you don't have to feel very apologetic that you woke him up at 4:30. He rarely sleeps. I don't know how he manages. Thank you very much, Afzal, for your kind words. I want to begin by saying, can I just share my slides? I will just go. Yes, slide share.
They are visible, yes. Slide is visible.
Oh, okay. I'll put it on slide share.
Yeah, please.
Okay. I just want to begin by saying that Dr. J.K. Trivedi has been a friend. It's indeed a great pleasure and honor and privilege to be delivering a lecture in memory of Jiten Trivedi. I have known him almost from the time that we were in a way co-travelers. Dr. Garg mentioned that he finished his MD in 1977. I finished my MD too in 1977. He joined as a lecturer at the KGMC in 1978. I joined as a lecturer at NIMHANS in 1978. And we have been good friends and co-travelers all through. I have had great occasions with him. We have been co-examiners. He was very kind enough to invite me to his department, for the BB Sethi oration and various other kinds of activities. So, as it has been said, that we lost him at the peak of his eminence and his contributions. He was very actively doing a variety of things. I have also had the privilege of speaking along with him in seminars and symposia. So it is indeed a great honor to speak in memory of Dr. Trivedi. And this, I understand, this is the J.K. Trivedi, 5th J.K. Trivedi Memorial Oration. Now, let me move the slides. Yes. So I chose for this a topic which I thought would be appropriate at this point in time. We don't know at what phase of the COVID pandemic we are in our country. The newspapers say that the second wave is almost in its vein. Many people say the third wave is going to begin, etc., etc. What I have shown on the slide is the famous picture of the COVID. God knows how it looks like, but this is what the journalists have popularized. Maybe this is the way it looks because it says that it's 10,000 times of a small dot. So you can imagine. But anyway, in the popular mind, this is the way the COVID looks like. COVID virus, which has caused a lot of havoc and destruction all over the world. I'm just having a little problem in moving my slides, but let me see. Yes. Yeah. So this is the cover of the latest issue of The Economist, the 3rd July edition. The cover story is, it is titled Long Goodbye. When I got this copy, I thought, oh, this is going to be, a lead article about dementia and Alzheimer's disease. Because in lay mind, when you talk about the long goodbye, you are mindful of, people, your near and dear elderly people, maybe parents, otherwise who suffer from slowly progressive, neurodegenerative disease, Alzheimer's disorder, the long goodbye. But I was surprised when I turned the pages. It was about the COVID. Has the COVID waned? Is it coming back, etc.? So the journalist there in The Economist called it the long goodbye. So we do not know. When I say post-COVID pandemic, post-pandemic, I'm sorry with this because my computer is frozen. I don't know. I'll just try and move the slides. If this, okay. So what I'm going to do in the next 15-20 minutes is to raise few questions. Psychiatry has weathered many upheavals and disruptive forces during the past century. So the first question is COVID-19 the most disruptive force faced by psychiatry? Is the pandemic a much needed wake-up call for psychiatry? And I would like to affirm that the pandemic offers us a wake-up call, because I'm going to say that the psychiatry practice all over the world has had major fault lines all these years. And will practice of psychiatry change forever? These are some of the things that I would like to pose. So how do I go about doing this? Are there any lessons from the past? I will briefly touch upon the lessons that we have had. And the other question is, what does post-pandemic mean? I've already raised this problem. Are we anywhere near the post-pandemic? We are, we are still in the midst of the pandemic. In different countries, it is at different phases, etc. How do we know that the pandemic is over? Many experts say that there may never be a post-pandemic period because pandemic is going to be with us. I will request everybody to mute their audios because it might be disturbing for the listeners. How do we know that the pandemic is over? And what are the fault lines in the practice of psychiatry pre-pandemic? Was the practice of psychiatry perfect before pandemic? So these are some of the things that I would respond. Any lessons from the past? Of course, we have the famous Spanish flu. We know that it went on for over 2 years. It came in waves. There were at least 4 major waves. If that is going to be true for our current pandemic, then we are only in second. In some countries, it may be the 3rd wave. So we are perhaps nowhere near the post-pandemic period. And of course, I'll not go into the details of the Spanish flu because it has been widely written about and everybody knows about it. It is not a flu which began in Spain, as everyone knows, but Spain was the only country during the First World War where there was no, control over journalists, and everybody elsewhere in the world thought that the flu came from Spain. Then there were the 2 world wars. The deinstitutionalization movement in psychiatry has been a major game changer, because suddenly over a period of 2 or 3 years and over a period of the next decade, they closed down all the big, huge mental hospitals, at least in the Western world. And then, of course, large number of people who were seriously mentally ill came out of the mental hospitals. And this occurred without any kind of pilot trial, randomized controlled trials, etc., etc. So that has been a game changer. I'll tell you a little bit of that. The Cold War which went on has had its psychiatric consequences. And probably the most recent major event has been the collapse of the Soviet Union and communism. Post-collapse of the Soviet Union, there have been major problems in all the countries in the communist bloc. Alcoholism went up, the rates of suicide increased, a number of things occurred. So perhaps while this may be the worst kind of pandemic and the worst kind of disaster that the whole world is facing, we have faced numerous similar kinds of events in the past. Now, let me tell you what are the fault lines. Again, these are all very familiar to us, so I would not take much time. There has been a huge treatment gap across the world. When we talk about the treatment gap, it is only the percentages that differ. We think that it's only in developing countries there's a treatment gap, but a country that I'm in the past several years very familiar with, I'm referring to Australia. It is one of the best resource allocation for mental health. But if you talk to health administrators, mental health administrators, they always use the word crisis. They say psychiatric services in a crisis. And mind you, this is a country with just about 25 million population, you know, about 13 to 14 psychiatrists per 100,000 population, huge resources available. And still they say there is a crisis and a lot of people don't get treated. So the treatment gap is a reality all over the world. It's much worse in the United States. In our country, in developing countries, it is terrible. So have there been fault lines? I mean, I'm now talking about the pre-2020, pre-pandemic days, pre-COVID days. There have been major fault lines in the way we have been treating psychiatric patients, huge treatment gap across the world, grossly inadequate resources, financial as well as trained human personnel, human resources. Why is that? There are lots of Indian psychiatrists in UK, in Australia, in many other countries, because they don't have their own enough number of psychiatrists. So the human resource shortage is a reality even in the most highly resourceful countries. In fact, you know, think about the developing countries, countries in Africa, countries in Asia. There, of course, there is also the problem of financial resources. Continuing universal stigma of anything mental. This is something, in spite of huge amounts of money having been spent on stigma reduction campaigns, even today, there is a lot of stigma about the psychiatry. They use the word mental. You know, in many countries in East Asia have been trying to change the name of schizophrenia, you know, to deal with the stigma problem. So this is a reality. Shameful neglect of persons with severe mental illnesses. This is again universal. In our country, in India, of course, the ever-increasing number of homeless mentally ill is a reflection of how we have been neglecting our mentally ill people. In fact, one of the things I have noticed is in the last 20 years or so, non-governmental organizations taking care of homeless mentally ill have increased. Why is that? The number of people, as India is advancing, you know, very much in economy, etc., you know, large number of people are going upward on the economic scale from lower class to middle class and middle class to upper middle class. We are neglecting our severely mentally ill people. Neglect of other disadvantaged and vulnerable populations. Ridiculously inadequate number of psychiatric beds. This is a problem. I mean, of course, in our eagerness to provide care in the community, we have abandoned people who require care in maybe for short periods or medium periods of time in institutions. This is a scandal, at least in the developed countries. In Australia, one of the biggest problems is the you know, shortage of emergency beds, shortage of psychiatric beds. So ridiculously inadequate number of psychiatric beds. In our country, probably maybe there are families or communities still take care of the severely mentally ill to some extent. But I mentioned already about the ever-increasing number of the homeless mentally ill. Economic and social policies which promote inequality. This is something which not psychiatrists, not health professionals, but economists have been talking about. we all know about the social determinants of health and social determinants of mental health. So solutions to deal with mental health problems does not lie only in the health department or only with mental health experts. The growing inequality has always been a big problem, not only contributing to health problems, but also mental health problems. I would touch upon, I said that one of the things that psychiatry has faced is the major movement of deinstitutionalization, which all over the world, at least in the developed world, because in countries such as India, or at least in large parts of Asia, mental hospitals have not closed down completely. They have only been transforming, and they are, becoming better in perhaps some ways. But what are the consequences of the deinstitutionalization and closing of mental hospitals? I told you about the homeless mentally ill in India, but this is a problem all over the world. Even in a country such as Australia, there are a large number of, a substantial proportion of people who are homeless are mentally ill. Then the scandal in America is the large number of people in jails and prisons with mental disorders. It is very famously said that the largest mental health care facility in the United States is the Cook County prison in Chicago. And then, of course, people who have gone out are in other institutions, like they are called homes, they are called hostels, etc. This is referred to as trans-institutionalization, the emergency room boarding, law enforcement impacts, and the number of violent incidences, etc. So these are all consequences of a major disaster, which are I wouldn't call it a disaster, but a major event which occurred in psychiatry. This is just to highlight how much of devastation it has got. This is Pulatori's famous book of The American Psychosis last year in 2019, just before, a few months before the COVID began. Pulatori, addressing the American Psychiatric Association's Institute of Psychiatric Services, mentioned he was giving the keynote address of the IPS in October of 2019. Rarely have so many well-meaning people been so wrong. My generation made major mistakes in emptying the state hospitals without thinking about how to treat the seriously mentally ill in the community. It's up to the next generation to solve those problems. Now, the point I'm making is that psychiatry had major fault lines even before the COVID pandemic began. This is, of course, this is a book which I always refer to, because Joseph Stiglitz, who is a Nobel laureate in economics, he wrote about the price of inequality. And he talks in this book about, he's an economist, he is not even a health expert. He talks about various mental health consequences and social consequences of increasing inequality all over the world. He has been a relentless fighter against this ever-increasing inequality. It is a fact in India, it's a fact in the United States. We know that after the pandemic started, the upper 1% or 2% have become richer, and 97% of the current outlook as a cover story saying that everybody has become poorer except maybe the Ambanis or the Adanis, etc., etc. So the inequality is a problem. And now poverty, when you look at social determinants of health, mental health, suicide, many other things, people are no more looking at the World Bank classification of poverty, which is just based on income. In fact, this is a very interesting research from the Oxford University. They look at multidimensional poverty. Poverty has to be measured from this multidimensional perspective, and that has not been improving. But if at all anything, the inequality is widening, and a certain section of the people are becoming poorer. Why I am highlighting this is that we all are very familiar with the social determinants of mental ill health. There is greater psychosis, greater suicide rates, greater prevalence of common mental disorders, etc. And if you don't deal with that, that would be a problem. Now, even before the COVID, the World Psychiatric Association, of which Afzal is the president, but under the previous president, I think it was when Dinesh or Helen was there, they had a Lancet Psychiatry and WPA Commission on the Future of Psychiatry. In fact, a whole issue, a major article in the Lancet Psychiatry published in October 2017, talked about the future of psychiatry. The point I'm trying to make is that we need to deal with lots of things in psychiatry, but I think this is a time when we can correct perhaps some of the fault lines which were there always. Psychiatry is on the cusp of major changes. It is time to look at where the specialty has been, where it is now, and to try to imagine its future. It is intended to stimulate thought, debate, and the changes and the change necessary for psychiatry to fulfill its potential as an innovative, effective, and inclusive medical specialty in the 21st century. So all that I'm saying is, it was not perfect. We can't blame the COVID pandemic for continuing problems, and now we have additional problems, and that is what I'm going to tell now. There have been a plethora of books about people from various backgrounds predicting about what will happen after COVID. I will just, again, there's no time to, Roy mentioned that all people have to go back to the clinic. There would be patients waiting. So I would want to finish well early, leaving some time for any discussion. I know that the whole meeting has to end by 10 o'clock. So I'll not go into the details of any of this, but many people have written about, what will happen, what is the shape of the world after the COVID, the post-corona, from crisis to opportunity. I've only picked up things which I've looked at in a very realistic and in a constructive way, how the world will be from different perspectives. Everything is going to change. Nothing is going to remain the same. Some changes are for better, some changes are not for very good. The COVID-19 catastrophe, what's gone wrong and how to stop it happen again. Most people predict that there will be similar pandemics in future. In fact, in a famous talk which Bill Gates gave in 2015, he said the major problem the world has to face is from a viral pandemic. He had predicted it. I don't know how he predicted it, but then he spoke not once, but several times about that before 2019. This is Richard Horton, the editor of Lancet, who talks about, how we can prevent possible future pandemics like this. This is by Fareed Zakaria, the 10 lessons for a post-pandemic world. I have no time to talk about this, but people who want to know more about this, even without getting a copy of the book, may go through the Indian Journal of Social Psychiatry, where in the current issue, Dr. Murthy has done an excellent review, and he has recommended that this is a must read for everybody in the field of psychiatry. So this is all from not psychiatry textbooks. These are written by people like Fareed Zakaria, who is a commentator on current events and future events. People who watches Fareed Zakaria's GPS, which is the pilot program in CNN on Sundays, would know that he's a thinker and he makes predictions. So many people have talked about it, and now I'll say my own predictions about future as far as psychiatric practice is concerned. I don't think the pandemic will pass very quickly. Of course, it will not be as bad as what we faced in India in the past 2 or 3 months. It's already come down. Today's paper says that it has reached the total numbers in the country, including the state where I'm in, Karnataka, are lower than the lowest first phase rates. The only 2 states where still it has to come down are Maharashtra and Kerala. But there is a news item in today's paper that there is a recent spike in Sikkim about the COVID. So are we on the verge of a third wave? We don't know. So it is not going to pass off very quickly. It will, of course, pass off. But then whether COVID will continue as an endemic, what are the vaccination rates? Even if we vaccinate the total population, as some of the Western countries have done, whether there will be mutants, will the mutants respond? There are numerous questions. There are more questions than answers. So what we have to do is to harness the potential of technology to provide more efficient and better care, as we have already begun. I'll refer to that later on. That is, I'm talking about telepsychiatry. Acknowledge that pandemics will be part of our future. This is what Richard Horton has said. This is what many others have said. In fact, one of the persons whom I personally know very well and work with, I'm referring to Dr. Norman Sartorius. 10, 15 years ago, he used to say that our major problem in the world will be from bats. I used to wonder, is he crazy? And then he would tell me bats have various kinds of viruses and it is this and that. And how futuristic he was when he said that there'll be a bat disease. We don't know the actual origin of this current COVID virus and where it came from. It's not for us to know, but we have to face the consequences. And we as psychiatrists will have to deal with the problems. So from the mental health perspective, besides all the fault lines that I referred to, what are the new things that we have to manage? There will be huge increase in mental health problems. Now, this is not rocket science. I mean, already, any number of papers are coming from all over the country, the anxiety levels, depression, grief, the pathological grief, because a large number of people have not only lost their near and dear ones, but they could not grieve in the proper way because they were all taken, for cremation without ever having any chance for relatives to meet them. So there will be a huge increase in the mental health problems of various types. Mental health consequence. And the other problem is that during the past 1.5 to 2 years, many people who are stabilized, people with mental health problems, but stabilized with treatment, people with schizophrenia, people with bipolar, because of the emphasis on COVID, many of them have had relapses. In the United States, data is just now coming, how disproportionately higher rates of people with psychosis died. They have the largest number of deaths, COVID-related deaths. Official records in India, taking the official records in India, it's United States. The unofficial records, maybe India is the country with the largest number of deaths. We still don't know how many people with severe mental illness died. But in United States, they have the data. And then in a recent paper, Alan Francis says that a disproportionately higher number of people who died due to COVID are people with severe mental illness. Mental health consequences of the economic downturn would be a major problem. Wider and increased awareness of mental health issues. That is, I think, something which has occurred. More and more people, the stigma perhaps is coming down because people are reaching out, to seek mental health problems. Because till quite a bit before the COVID, it was somebody else's problem. Now you are also facing pathological grief, you're facing depression. So the increase in the prevalence of various problems may be contributing to more and more people reaching out, and wider increased awareness of mental health issues is also going to be a challenge for mental health professionals. Increased funding, investment for mental health, I put 3 question marks because with all this, I do not know whether that will occur, but it is a challenge for leaders, amongst all of us, people like Dr. Rakesh Chadda, who is the Secretary General of World Association of Social Psychiatry, Dr. Afzal Javed, who is the President of the WPA, etc., to get more and more funding, to advocate for mental health, and to tell everybody all over the world that mental health problems are increasing, and maybe, it might contribute to increased funding and reduction of stigma. The rapid advent of remotely delivered healthcare for non-essential services, telemedicine, which was only something for remote people. In Australia, telemedicine, you talked about telemedicine, it was for remote and rural Australians because no doctor, no psychiatrist ever wanted to go there. So you use technology, telemedicine. In India, of course, it has been used, it is being tried out. But in the past 1.5 years, it has taken a major leap. Will telemedicine become the mainstream form of patient interaction? Probably yes. Can video visit fully substitute for an in-person visit? That's a question mark, and we need to reflect on that. Before I conclude, I'll say a word or two about that. And what will be the preferred model? So these are all questions that we need to answer. Now, let me quote Alan Francis, who, quite recently, not so recently, but in the later part of 2020, mentioned that telemedicine is the latest disruptive communication technology to revolutionize medicine. In medicine, we have had major revolutions, but he says telemedicine is the latest disruptive communication technology. Lots of things are going to occur through mobiles and mobile communication technology. The switch in psychiatry from office practice to telepsychiatry has been incredibly smooth and rapid. So this is one of the consequences. And he predicts that telepsychiatry is not just a temporary emergency response to the pandemic. It is the way of the future. And the people who have been seeing and consulting their psychiatrists through this telemedicine, telepsychiatry channels, now realize that this is much better. You don't have to go and wait in the psychiatric, the consultation rooms. You don't have to be seen by other people. You can see the psychiatrist in the privacy of your room. If the psychiatrist wants to have a word with a significant family member, it is no problem. Otherwise, you have to take your father or you take your wife, etc., for the consultation. So many people are now realizing that telepsychiatry might even become the preferred mode. But then, as I conclude, let me raise some questions for your reflection and your thought. See, for millennia, the laying of hands represented the essence of the doctor-patient relationship. If it is a general doctor, whether you need to check the pulse or not, what you expect. As we have grown up, when we went to see a GP or a pediatrician, they always touched us, checked our pulse, maybe auscultated using a stethoscope. They came face to face, very near. Isn't being physically apart antithetical to the essence of medicine? This is a question that we have to, but then of course, modern technology makes various things possible. And can remote care facilitate transfer of trust, empathy, and compassion? I have not been doing much clinical work ever now since I am currently on leave, but I know most of the practicing psychiatrists in India do much of their work through this remote care, and they should reflect and answer some of these questions. And one of the things that we need to do is to compare face-to-face versus screen contact, and what are the benefits and what are the disadvantages. So I would end by, there is a book which came few months before the pandemic began by Eric Topol. Deep Medicine is the title. He talks about, of course, in the book, he mainly talks about artificial intelligence. And what he says is, at least in America, medical practice, he is not talking so much about psychiatry, but medical practice in general had become so very dehumanized. And he says that technology will help solve some of the problem. So thank you very much for a patient listening. I'm again grateful to all the organizers for giving me a chance to remember my good friend Jitin Trivedi by inviting me for this 5th memorial lecture. Thank you very much.
But we have just 10 minutes. We will conclude at 10 with the vote of thanks, formal vote of thanks by Dr. Varghese Punnoose. I would first invite Dr. T.S.S. Rao, Secretary General of the IPS, to make a remark. Over to Rao. Rao, are you here?
Hello. Yes, I'm there. Able to hear me?
We can hear you. We can hear you.
Okay. I'm really very happy for the invitation that was extended. Dr. JKT was mentor to many, and I am one of them.
Excuse me, Mohan Isaac sir, can you stop the screen share?
Okay. I will do that. Sorry. Give me a minute. I'm just doing it.
Continue, Rao. You can continue. Rao.
Okay.
Yeah.
Okay.
Please
I'm in
continue.
the car and there may be little noise, almost reaching Mysore. I'm really grateful for this invitation. I still remember very vividly our ticket is for a simple reason that it was in Mysore conference that he handed over me the charge to take up Indian Journal of Psychiatry. Lot of things have been spoken that how simple he was, academician, researcher, and over and all one of the very simple human being. And I still remember what he had told me, that the journal should be self-sufficient and use the amount 26 lakhs what he contributed, we never touched for the publication even in the initial phases. So the simple fact is that a person is a leader who can really emulate him and try to carry out the responsibility. From that particular angle, this over and above the person who has spoken, Dr. Mohan Isaac, again another embodiment of academics, research, and almost over and above a simple human being. Each and every time, in fact, I'm meeting him, and maybe in this pandemic, we are meeting each other so frequently, and I'm really very happy that the pandemic, its effect, and the coming days, what's going to happen, was dealt with. I very fondly remember JKT, and would like to emphasize that we all need to follow the guidelines and steps what we have covered. Thank you very much. Congratulations, Dr. Rai.
Thank you, Rao. I can see Dr. Sonu Gain from Canada. Sonu, are you here? If you are here, please unmute yourself and you are welcome to say a couple of words. I can see you. Are you here?
Thank you, Roy. It's a pleasure to join this this lecture, and also to see my many esteemed colleagues from across the world. I found the lecture particularly fascinating because for those of you who don't know me, I practice in Canada, and so much of what was discussed is relevant no matter where we practice. And I think you've very insightfully picked out themes of relevance that we will all need to be considering as the practice and model of psychiatry evolves in coming years. And the COVID pandemic, it's a bit of the tip of the iceberg, because I think in many ways, how we move forward from this is going to define the next phase of psychiatry across the world. So thank you very much for your insightful thoughts. I think it's left us much to consider as we move forward in our respective countries.
Thank you, Sonu, very much. I can see Dr. Ajit Bey, former president of the IPS. Ajit, would you like to say a few words?
I just want to thank Mohan for a brilliant presentation, as usual. Most importantly, we have been riding on the fast developments in technology, and I think psychiatry is, in a sense, has not paid enough attention to what technology can do. But a word of caution, let us not get carried away by technology. But that was a message that came through very, very clearly, and the importance of the face-to-face contact. Thank you, Dr. Mohan.
And for the last comment, before water thanks, Professor Srinivasa Murthy. Over to you, sir.
Thank you very much. Thank you very much. I just want to make a very brief comment. It has been a very, very good lecture, raising number of issues, which if we had time, we could have talked about it. But two things which I wanted to pick up from what Dr. Mohan said, which I think we all need to carry. One is we need to harness the lessons of this pandemic, not get hassled by it. I'm especially saying it because yesterday in the group, IPS group, there was a thing saying that there's nothing like mental health issues due to the permit. That will be a wrong thing. The second thing is this is an opportunity for us to rebuild resilience in individuals, families, and communities. And I plead that we look into this and work upon it as much as we are working upon looking after the mentally ill people. Thank you very much, Mohan. Thank you, Rai. Good luck. Good day.
Thank you very much. Now, the last item is the vote of thanks by Dr. Varghese P. Punnoose. He is a professor and head of the Department of Psychiatry at Medical College Kottayam. He is also the secretary of this National Alliance for Mental Health, of which Dr. Trivedi was the founder, vice president. Over to Dr. Varghese.
Good morning, all of you. It has been a very enriching morning. All of us are busy with our work on this working day, and several senior colleagues across the globe have joined at very odd times. So my duty is it's a sweet one to thank each and every one of you. First of all, I should express our sincere gratitude to Professor Afzal Javed, who is the president of World Psychiatric Association, to join this meeting at a very, as Professor Roy was telling, very unearthly hour of 4:30 a.m. Even though Professor Mohan said we need not be apologetic. It is, I'm sure that it was on a diplomatic tone he made that comment. Really, it was a great sacrifice, and it is a token of our token of his goodwill and friendship to Indian psychiatry, and especially to National Alliance of Mental Health. A very hearty gratitude to Professor Afzal Javed, sir. Then, of course, Professor Mohan Isaac. It's every time when we listen to Professor Mohan Isaac, sparks occur, new ideas come, and our thoughts and our perceptions are taken to a different level. So it's always an enriching experience, and I'm sure that all of us who were lucky enough to listen to Professor Mohan Isaac sir in this morning, they leave better educated and enlightened. Thank you, Mohan Isaac sir, for this beautiful presentation, and for the Trivedi oration lecture, which is one of the prestigious events we have held this year. Thank you once again, sir. And again, I should thank, we have very senior persons, Professor Rakesh Chadda, Dr. Usigar for want of time. I'm just mentioning Professor Murthy sir. Thank you for your presence and your comments. And we have eminent personalities like Dr. T.S.S. Rao, of course, has taken mantle from Dr. Trivedi. I find Dr. Debashish Basu, Dr. Sonu, Dr. Nandakishore, Dr. Ajit Bide, Dr. Rupsidana. I don't know whether I'm missing anyone. Dr. Sagar, Dr. Joseph Varghese, and many people have found their time. I can find Dr. T.S.S. Rao still traveling and attending the meeting from his moving car. So thank you, all of you. Many trainees and many junior people have joined. They have taken time off from their regular work schedule. Thank you very much. Thank you very much for joining this session. And my pranams to all the people who have attended. Thank you all. Thank you very much.
Thank you very much, Dr. Varghese.
I glad to thank Professor Roy Kallivayalil, who is the master brain behind all these things.
You are also part of it. You are also part of it. Thank you very much for all the distinguished guests, especially the speaker, Mohan Isaac, Dr. Afzal, and all dear friends. You know, Dr. Trivedi was always a stickler for time. So if he would have been there, he would have insisted we are closed on time. We are 1 minute to 10, and with this word, we have with great pleasure to adjourn this meeting. Thank you very much for all of you. Thank you once again.
Thank you.
Bye-bye. You did over.
Bye.